Many of the symptoms you experience every day are practically screaming about impending death, and how quickly you take action could determine not just your health, but your very life. What subtle signs point to deadly diseases or other acute and critical conditions? Let's break it down in this video. Be sure to watch until the end and share this with your loved ones to help keep them safe. Every day, thousands of people around the world die from strokes, heart attacks, and other acute conditions. And many of these deaths could have been prevented if the person or their loved ones had paid attention to the symptoms in time. But here's the paradox. Life-threatening conditions rarely start, like in the movies with loud screams and collapsing to the floor. On the contrary, it all begins quietly, almost unnoticed, with something like fatigue, a headache, heaviness in the chest, or just a feeling that something isn't right. And during this time, irreversible processes may already be happening in the body. Brain cells die, the heart muscle perishes from lack of oxygen, and a blood clot blocks a vital artery. And now I'll tell you about 5 signs that deadly diseases may be developing in the body. First, a sudden worsening of breathing and shortness of breath. Almost everyone has experienced shortness of breath at least once in their life, like when it's hard to breathe after physical exertion or because of a cold. But what should you do if you experience shortness of breath for no apparent reason, or if it even appears while you're at rest? If this is accompanied by chest pain, a feeling of pressure or heaviness, these symptoms could be signs of blood clot formation or a heart attack. In some cases, this can also be a sign of a stroke. You shouldn't waste time trying to figure this out on your own. Call an ambulance immediately, especially if the shortness of breath doesn't go away after a few minutes, even when you're sitting still. Like this video so that as many people as possible can see it and maybe even save a life. Second, sudden severe headache. Headaches in general are a common problem for people of all ages. But what should you do if a headache comes on suddenly, is intense, and doesn't go away even after taking painkillers? If a headache is accompanied by vomiting, loss of coordination, weakness in the body, especially with facial asymmetry or slurred speech, it could be a stroke. And the sooner you get medical help, the higher the chances that the consequences will be minimal. Don't try to mask the pain with painkillers like paracetamol or ibuprofen. They won't solve the underlying problem. They'll just cover up the symptoms. That's even more dangerous. The faster you get medical help, the better your chances of recovery. In fact, many people don't even realize that our daily habits can lead to the most serious consequences. Even something like poor posture or tilting your head down while looking at your phone. These things can slowly but surely lead to a heart attack or stroke. Third, weakness and paralysis on one side of the body. If you suddenly start to feel weakness in one arm or leg, or notice that one side of your face is drooping, that's another serious sign. These symptoms may indicate a stroke, especially if the paralysis or weakness comes on suddenly. When these symptoms appear for no apparent reason and are accompanied by speech or coordination problems, it's a reason to seek medical help immediately. Don't wait for it to go away. Call an ambulance right away. Stroke treatment requires urgency. The faster you get help, the less damage there will be to the brain and organs. Subscribe and watch the suggested videos to catch problems in time and protect your health. The 4th sign is sudden chest pain. This is one of the most alarming signals. It's especially dangerous if the pain doesn't depend on your body position, doesn't go away after 5 to 10 minutes, radiates to your left arm, neck, or even jaw, and is accompanied by cold sweat and weakness. Such pain may indicate a myocardial infarction. And the longer you wait, the more areas of the heart can die. So call for medical help immediately. And the final, 5th sign is speech disturbance or difficulty understanding speech. For example, you or a close friend start speaking incoherently, lose your train of thought mid-sentence, can't find the right words, lose track of the conversation, or you listen to someone and the meaning of their words just slips right by you. At first, this might look like ordinary fatigue. I'm probably just overworked, the person thinks, or I'm really slow today. But if this happens suddenly and for no apparent reason, that's a whole different story. This is a warning sign, especially if it's accompanied by confusion, drowsiness, slowed reactions, or dizziness. And the most likely cause is impaired blood flow to the brain. This could be a transient ischemic attack, also known as a mini-stroke. In addition, this could be a sign of the early stage of a stroke or a serious vascular disorder. Another possibility is a side effect of certain medications, especially in the context of dehydration or when taking sedatives or anticonvulsants. These symptoms may go away after 15 to 30 minutes, and the person decides that everything is fine. But after such an episode, the risk of a full-blown stroke is at its highest within the next 48 hours. You shouldn't put off seeing a doctor or just try to sleep it off. At the first sign of speech disturbances, you should first call an ambulance. Second, record your speech on video to show a specialist. And third, see a neurologist and get an MRI of the neck and head vessels. And don't try to fix speech problems with rest or coffee. That won't help. A neurological malfunction is no joke. The sooner you find out the cause, the better your chances of avoiding serious consequences. What other symptoms do you think are worth mentioning? Share your thoughts in the comments. Let's go over them together. In this video, we discuss the signs that may indicate critical conditions and lead to serious consequences, and how important it is to recognize them in time. This can be the decisive factor that determines how much time passes before emergency medical help is provided. And the faster the decision is made to call an ambulance, the higher the chances that the person will survive and avoid irreversible damage. This was Dr. Glynn with you. Be sure to subscribe to the channel. Stay healthy. See you in the next videos.